Hey guys, Don here. I want to talk today a little bit about doing packages for things that we offer in the office, and really, it's something that I don't feel all that comfortable with. Currently, I have a coach who's a podiatrist. He's actually in another country, and he's kind of helping with some tips. And one thing that they do there quite frequently, but it's still not common amongst the podiatrists, is doing packages. And so I just kind of want to walk you through this because it's something that I'd like to know your thoughts. You could certainly reply to this podcast. You can hit reply and it'll come to me, or my email will be around there. But how many of you offer packages? And basically, what I'm thinking about is, and it's based on an experience that I had recently. Recently, I was talking to someone that's a coach, and I was saying, "Well, I want to be maybe coached." And before I they started with this thing called a clarity call, and they said, what I'm hoping to go over is kind of what I do, how I do it, and kind of what the cost is going to be for everything. And and they said, "Is that okay? That's what we're going to plan." And I said, "Yeah, that's fine." And so I was expecting at the end for them to go over the price, and they did that. They went over, this is the price and this is kind of their process and everything else like that. And it what I find is we kind of skirt that question. We don't, as podiatrists, like to talk about money. I'm not comfortable with it. I don't think you're comfortable with it, but it's something that we have to talk about, or we can let our staff talk about. I know I interviewed Chris Titko, and that'll be coming up, and she has an office manager that has all of those uncomfortable conversations, and basically a really good person that's able to answer the questions and help the patient to make the decision, so the doctor doesn't ever talk about money. And I think that would be ideal, but I don't think that's the case for a lot of us. And what she does is, let's say someone comes in with metatarsalgia and they need a shockwave or like an amnio injection. Basically, they'll introduce the topic, and then they'll have the office manager kind of go through all the documentation, explaining what it is, explaining the pricing and everything like that, so they can totally stay out of the money aspect. I'd like to know what you guys do, if you do that, or if you talk about it, because I know what I do is uncomfortably, sometimes I have to say, our amnio is $1,500, or our orthotics are $550, or the shockwave, we have radial and focal, so we're doing it $200 per session, and you'll need between 3 and 4 up to 6 sessions of that. And those are kind of uncomfortable conversations. So what I'm trying to do now is to talk about packages, and I introduce it in the beginning. And what that kind of looks like is, when I see a patient, let's say we're going to talk about plantar fasciitis, I'll say, Mrs. Jones, today I'm going to go over what you have, kind of what's causing it, and what's the costs involved in terms of the treatment options, and how much time it's going to take you to get better. And that's the approach I'm starting at the beginning now, and I'm just working on this. I'd like to know if you guys have any better ways of doing this. And basically, so what I do is I see them for the plantar fasciitis. I'll go through my presentations that I've talked to you guys about before. Basically, it's a presentation, shows a picture of the diagnosis, kind of the different causes with the tightness and things like that. And then it has basically a picture of a checklist of all the different types of treatments. Now, when they see that, they get really kind of overwhelmed with all the different treatments, because there's hundreds of types of treatments. And then I try to kind of simplify it as well. How long have you had it? And if it's been over 3 months, I say, well, it'll probably take about 3 months to get rid of it. If it's less than 3 months, it'll probably take less to get rid of it than 3 months. And then I'll go over, and usually then that's where I have to pick this amount. So if you add things up, right, and if you think about it in the long term, we have a couple of patients that will do a cortisone, and they'll get right better. But the majority of them aren't like that. The majority of them take between 3 and 6 months to get better. And so what I'm telling my patients, and this is kind of what I'm working on right now, is, it's going to take you about 3 months to get better. Okay, it's going to take you 3 months, and usually it costs about $1,200. And where did I get that $1,200? Well, in my practice, most people are getting the shockwave, so they're getting 3 sessions of shockwave, and it used to be 6 when I only had the radial, but now I have the focused. And so let's say that's $600. And then you have, if they need it, they'll do like an orthotic. They might do a foam roller. They might do other types of things. And those are just the $1,200 are just the things that the insurance doesn't cover. Like if they don't cover an ultrasound. So I just pick a number and I bring it out right in the beginning for them, so that anything else that I talk about is kind of going to be within that realm. And that's kind of the new thing that I'm trying to do. And I've had this conversation with a couple of patients. And when we bring it out and we talk about the white elephant in the room, it's a lot easier for patients, because some, they're like, there's no way I can do that. Others are going to want to, well, how can I afford it? We talk about care credit and other things like that. And so I'd like to know your opinion, what you think, if you guys package anything, how that's going for you. Also, I'd like to invite some of you guys. I'm kind of happy in our website, Podiatry Practice Mastery. We've now got up to 100 people that are interested in the group sessions. So we only have 100 places at each of these group sessions, and I'd like you to be present there. So I'd go there and I'd put your name and email, and we'll send you the information if you wanted to be part or get the recording afterwards of that group session. Okay, have a great day.